So fluoride use is a fairly controversial topic with numerous debates against its use due to it being neurotoxic and unhealthy for the body. I wanted to focus this video mostly on the dental benefits of fluoride, and I'll mention at the end of the video my thoughts on the overall health effects of fluoride. So the teeth, they're comprised of three layers. We have the pulp in the middle, the dentin layer, and the outer enamel layer. Enamel is said to be the strongest mineral in the body, and it consists of water and various minerals, the primary mineral being hydroxyapatite. And hydroxyapatite is a crystalline calcium phosphate. So dental pain via the root of caries results in decay moving from the outer enamel layer to or close to the dental pulp. You might understand already how dental caries occurs. The simple explanation is that you have bacteria in the mouth present in plaque and calculus, and the bacteria metabolize sugar for energy and release acid as a byproduct, which decreases the pH of the plaque biofilm, making it more acidic, and this increased acidity contributes towards dental caries. So that's a very simple way to understand how caries work, but in reality it can get a little bit more complicated, because acidity is a measure of hydrogen ions, and the more hydrogen ions released, the more acidic in nature the acid is. When we have this acid layer on the tooth surface, phosphate ions in the saliva combine with these hydrogen ions from the acid. To balance the loss of these phosphate ions in the saliva, they're pulled out of the teeth and into the saliva. So because of this acidity, the tooth has lost phosphate ions in a process called demineralization. Once the pH returns back to normal, phosphate can move back into the teeth in a process called remineralization. Although the teeth are in this constant state of demineralization and remineralization, when demineralization occurs more, the overall effect is a loss of tooth structure and the formation of dental caries. I hope this explains how dental caries occurs. Since enamel cannot be remade or recreated again, it's important to remember that cavities need to be filled appropriately and decay needs to be removed. Tooth enamel can only be remineralized when it hasn't turned into a cavity, and once cavitation occurs, a filling is usually required. So let's talk about fluoride now and how fluoride works. Fluoride can be taken into the body by normal water intake in fluoridated areas, fluoride tablets, fluoridated foods, toothpastes, tooth varnishes, and mouthwashes. The purpose of this intake is to have fluoride ions present in the saliva. When fluoride ions are in the saliva, when the teeth remineralize, instead of forming hydroxyapatite like we mentioned before, they form fluoroapatite. Fluoroapatite is more resistant to the loss of minerals compared to hydroxyapatite, even in acidic conditions. Not only this, even if there is an acidic environment, having fluoride ions in the saliva still promotes remineralization. So if you've understood that caries occurs by a process of demineralization occurring more than remineralization, it should make sense that after the introduction of fluoride and the formation of fluoroapatite, which is more resistant to demineralization than hydroxyapatite, and that it promotes processes of remineralization, fluoride use is an excellent way to reduce the risk of caries. So in regards to the systemic effects of fluoride, I've read studies suggesting that fluoride contributes towards reduced cognitive function. It's been speculated that it could promote hypothyroidism in those who are iodine deficient because fluoride tends to compete with iodine in the thyroid gland. I definitely feel like there needs to be more extensive research into the overall systemic effects of fluoride with larger test groups, as a lot of the studies I read only showed a very small sample size. Even though there's still some research showing potential negative consequences of fluoride systemically, there are hundreds of research papers showing the dental benefits of fluoride. What you have to remember is that there's so many emergency room visits associated with dental pain. So the patients have excruciating pain because of extensive decay, abscesses which need to be drained, or they need to take a course of antibiotics. Then they actually need to treat the teeth, which is either costly if they go the route of having a root canal or a crown, or the cheaper option of an extraction, which means they have missing teeth in the mouth. And that can affect the way they bite and how they chew. Had the patients received proper education in regards to their diet, oral hygiene habits, and appropriate fluoride therapy, I feel like a lot of these situations could have been avoided. So that's my stance on fluoride. If you're adamant on avoiding fluoride altogether because of the systemic consequences, then you need to at least ensure that you're being very meticulous with your oral hygiene. So you need to be ensuring that plaque doesn't build up on your teeth, and that if it does, it needs to be removed as soon as possible. I still recommend a fluoride protocol in the mouth only, so that means using fluoridated toothpastes and mouthwashes. Fluoride tends to remain in the saliva up to 5 hours after use, so that would definitely have a beneficial effect on reducing your risk of dental caries. Additionally, local fluoride use in the mouth causes a very minimal rise in blood levels of fluoride, so if you are worried about the systemic effects of fluoride, this may be a safer option for you.